All right, so this is Eunice with Florida Training Academy and NurseEunice.com, and in this video, we're going to be performing the transfer from the bed to the wheelchair skill. As we begin every skill, we always want to knock and introduce ourselves. Don't forget to wash those hands, provide privacy, and remove the call bell. So let's prepare our wheelchair. Before we put a patient inside of a wheelchair, we first want to lock the brakes. The pedals or the footrest should be up. And then there's usually a lever on the inside of your wheelchair that once you engage it or pull it, it should allow the leg of the wheelchair to go back. So when you're putting a patient in the wheelchair, there shouldn't be anything for your patient to step over. Let's do this again for classroom purposes. All right, so I've just pulled my wheelchair to the patient's bedside. What's the first thing I do to ensure safety? If you said lock the brakes, you're absolutely correct. Let's lock the brakes. You don't want your patient stepping over anything because they can fall. So we're going to raise the pedals and then move the legs out of the way. And this is how you prepare your wheelchair for a patient to be transferred from the bed to the wheelchair. Knock, knock, knock. Come in. Hi, good morning. My name is Eunice. I'm your CNA today, and I'm here to put you in the wheelchair. Is that okay? Yes. All right, before I begin, let me go wash my hands. Okay. All right. And so don't forget to wash your hands. Hands are clean. We're going to provide privacy by closing the curtain. And I'm just going to remove this because we don't need it right now. How are you feeling today?
I'm feeling good.
I'm going to prepare my wheelchair first. So I'm going to lock the brakes as we showed you in another video. I'm going to bring the pedals up, bring the leg of the wheelchair back, and repeat the process on the opposite side. Okay, I'm going to gather your legs and bring you over. Okay. Can you scoot over a little bit for me? It'll be a little bit easier. Perfect. And 1, 2, 3. Let's go ahead and get you over to the side. We have to make sure that your feet are on the floor, so I'm going to try to lower the bed a little. And this is as low as the bed goes. So let me get you some shoes on. And then I'm going to make sure that your feet are touching the floor. Can you touch the floor for me? Great job. We're going to apply the gate belt, and this just helps me transfer you safely. Doing a 2-finger check, making sure only 2 fingers fit inside of the belt. Are you feeling any discomfort? No. Okay, so our feet are on the floor. I'm just going to bring this wheelchair a little closer. I'm going to park your legs just a little. And so now your arms go on my shoulders, and on the count of 3, I'm going to stand you, turn you, and sit you into the chair, okay? Okay. 1, 2, up on 3. Turn and sit. Great job. How do you feel?
I feel good.
And so now, I'm going to put 2 feet on 1 pedal. And I don't have to lock the wheelchair. The wheelchair still moves side to side, even though the brakes are locked. If you don't feel comfortable doing that, or if your patient's heavy, you can unlock the brakes, but do place the lock back. Because for the state of Florida CNA exam, your patient's not going anywhere. They're just going to be in the wheelchair for a little bit. So here's your call bell. Is there anything else that I can get you right now?
No, ma'am.
There you go. Okay. I'm opening your curtain. Washing my hands, and you are done with your skill. We'll see you in the next video. This is Nurse Eunice with Florida Training Academy.